Welcome back. We're at the Beebout Veterinary Medical Center, and I'm with Dr. Brandon Beebout, and he has another very special guest this week.
Yes, this is Zuma.
Zuma. Okay, what is going on with Zuma?
So Zuma is currently in the midst of treatment for IBD or inflammatory bowel disease.
Okay.
So she is a unique case in this. We see inflammatory bowel disease a lot. It's very, very common in both dogs and cats. And with her and many others that we have diagnosed over the years, she was very... She had some chronic diarrhea, but really felt well. It was energetic. She ate fine. There was no vomiting. And so, you know, I got some medications. It would resolve, kind of come back. And then had come in for a procedure where we ended up doing some lab work, and she had what's called hypoalbuminemia, which is a low albumin, which is our protein produced by our liver in the blood. And so there's not very many reasons for that. And there were some other changes, like a low calcium, a low cholesterol, and all that screamed, I'm not absorbing what I'm taking in. And obviously with the diarrhea, that was one of our concerns. And so there are many ways of trying to go about diagnosing inflammatory bowel disease. And as we kind of have discussed, we have a gastroscope, and so you can actually use an endoscopy, which is minimally invasive. It is you're out like a light for just a few minutes, 40 minutes or whatever, and you can go in there, snake through, you can see everything grossly, and then you can actually grab biopsies and get your answer from that biopsy.
Wow.
Where back in the day, I mean, even just a year or two ago, we'd unzip you, go in there, exploratory surgery, take full thickness biopsies. A little higher risk with those type of things. It's something that we've done routinely, but now, again, we can do it minimally invasive. And then there's also a blood test where she tested well for IBD, let's just say, in that blood test. And so, and with German Shepherds specifically, you know, they're known for things like EPI, which we hear commercials on the radio for all the time, exocrine pancreatic insufficiency. Didn't fit completely with that, and IBD is the diagnosis, and so she's in the midst of treatment for that. What do we do for treatment? Is a few different. We hit them multimodally. So one big one is B12. We got to get B12 in these guys. It's got to be injectably because you need B12 to absorb B12. And I don't have B12, so I need to be giving that B12 injectably. We do that over a series of weeks and then actually a series of months, monthly for 6 months as well. A diet change is kind of the gold standard. Many, 50% or more dogs and cats will get better with a diet change alone. And people routinely come in, I've spent all this money on this diet food or on this different diet that for the IBD or the food allergy. Well, we are very, very picky. Because we want you to, if you're going to pay a premium on your dog food, we want it to be one that has quality control at the manufacturer. We don't want that chicken protein to be running on the same conveyor belt as the salmon protein, which I think I've mentioned in other ones. And so we are very, very picky on those brands that we know that we can trust. And then there's two different ways you can go about it. Hydrolyzed protein, so that is breaking down that chicken protein or whatever protein that is down into short chain amino acids. Or you go to a novel protein like kangaroo, puma, alligator. And so they venison, duck, rabbit. We got to be careful in Nebraska. We have lots of hunting dogs. We have lots of country dogs. They could be exposed to those proteins, the duck, the rabbit, the venison, because we have those out in our fields. And so we just have to be a little bit careful, do our due diligence with our history, taking the history. And then these guys are actually on, it's an immune disease, so they're actually on immunosuppressive doses of steroids. And she is currently on that. You wouldn't know it. You and I would be very, very irritable and probably a little puffy in the face. And so she's handling it really well. It is definitely a serious disease. There is a huge spectrum on the severity, and she's up there. She's definitely in that you know, second, third as far as severity because we've seen that drop in that albumin. And so she's a fighter. She's a very, very good dog. She takes all her meds. Her mom is very, very good about coming to all the appointments. And she's already gained some weight, and she's liking her new food and that kind of thing too.
So she'll be on this treatment forever? Is this until she gets...
Super question. So hopefully we get this resolved, we drive away those inflammatory cells in that gut, and then we taper down slowly but surely off of those steroids to make that immune system kind of forget what it was doing. And we've also decreased that immune response because of that diet change. So it's not affecting that diet, it's not stimulating that diet to get angry and create some more inflammation.
Wonderful information. I'm glad she's doing better.
Of course.
Thanks, Doc. Appreciate it. All right, stay with us Monday as we bring you another edition of Pet